Hi, I'm Jonathan Hahn, a dentist here at Ivory Point Dentistry. And as a dentist, my priority is your oral health. One overlooked part of oral health is actually sleep apnea. Sleep apnea is a sleep disorder characterized by pauses throughout the night. The one that I focus on is obstructive sleep apnea, where the airway is actually blocked throughout the night. Some signs of sleep apnea include if you snore throughout the night, if you find yourself awake throughout the night, even being tired throughout the day is another sign, and falling asleep really fast, things of that nature. Some other signs on my end is if I see an obstructed airway, or if there are signs that you're clenching or grinding throughout the nighttime, that's also a sign that you might have obstructive sleep apnea. So untreated sleep apnea and untreated sleep disorders can have a pretty negative effect on your life. This includes increased risk of accidents like car accidents. It could also make your immune system weakened as well. Could lead to kind of cognitive decline and can increase your risk of stroke or heart disease as well. Now, when I talk about sleep apnea, a lot of patients already jump to signs thinking of things like a CPAP. That's that mask that you wear at nighttime. It's attached to a hose, attached to a loud machine. And a CPAP, although it does work well if someone's able to use it, a lot of people are not able to. There's actually studies that about 50% of people that have a CPAP don't even end up using it. So there is another first-line treatment that can be used. It's called an oral airway device. And that's what I'm going to be focusing in on. For something like mild to moderate forms of sleep apnea, an oral airway device would actually work really well. And the idea is actually right here. It's actually a device that's tailor-made to your mouth. It fits on the top and the bottom, and it's something that you wear at nighttime. And it's actually great for something like travel as well. So many patients that I've made this for have actually noted a really big change in their lives. They notice that they're a lot more rested throughout the day. They're not waking up in the middle of the night anymore. And a big part is that their partners aren't hearing them snore as much anymore too. So even if you try to CPAP and it's not working out for you, it'll be perfect to just come on in. We'll see if the oral airway device fits your needs. And that way you can have something and get a good night's sleep without having to fuss too much. So if you come in for a consultation, it's a really easy process. I'll just take a look at the airway, maybe take a look at your bite, how things come together. And to actually get it made, it's a very simple process where we just take a 3D scan of your mouth, take some measurements as well, and then send it off to the lab to be made. Again, it's going to be custom made to your mouth, and it's going to fit perfectly. The process after that is pretty non-invasive. Once I deliver it, we might have to just tweak it a little bit here or there over the course of a few weeks to a few months to get it perfect. But like I said before, patients, even in the very beginning, already notice a huge difference. So if you have any questions about sleep apnea or the oral airway device, you can feel free to come in to the office for a consultation. I'd be happy to talk about it. And if you have a dentist that you already see, I'd be happy to coordinate with them, collaborate with them in order to get you this device. Or if you're looking for a dentist, I'm here as well. Happy to have you as a patient and take care of you. Thank you.